With all your due permission, sir, we are live. So can we begin?
Yeah, ma'am.
Yeah. Good evening, everyone. This is Batul from IGCP, and I would like to welcome all the viewers who have joined our platform for the better exchange of knowledge that is going to be shared by our keynote speaker doctor for today's session. Well, sir needs no introduction at our platform, but it's our pleasure and honor to introduce him. He's none other than the very renowned Dr. Uday Kumar Jadhav, sir. Sir is MBBS, HIV, PDCR, AFIH, infectious diseases consultant and in charge at Art Center and L&T MDACS Mumbai, owner of Life Care Clinic, Total Care in HIV AIDS, Aurangabad, Maharashtra, and attached to Panagia Super Speciality Hospital, Aurangabad, Maharashtra, consultant at the Shraddha Hospital and Critical Care. So with Sir's help, we'll be talking about the topic for today, which is CMV infection, diagnosis and management in HIV infection. Before moving on to today's session, let us have a brief look on what the topic says. Diagnosis and management in HIV infection. Diagnosing and managing CMV infections in individuals with HIV infection requires careful attention due to their compromised immune systems. Monitoring CMV viral load and immune function is crucial to guide treatment, adjustments, and prevent long-term damage. So we'll be learning more about the diagnosing and managing CMV infections in HIV positive patients with Sir's wonderful insights. So now without any further delay, I would like to welcome Sir at our forum and would like to hand over the session to him for his talk to begin. So over to you.
Yeah, good afternoon, everybody. Welcome to today's topic, a very crucial topic in the field of HIV, the cytomegalovirus infection. Today, we are going to discuss the diagnosis and management in HIV infection. Cytomegalovirus is one of the virus which has quite a big impact in the human body before HIV and also with HIV. The cytomegalovirus is a double-stranded DNA virus, and it is from the herpes virus family. They can be in the body, disseminated or localized, and also cause various end organ disease with people with HIV and with advanced immunosuppression. Most clinical diseases occurs in individuals who were previously infected with CMV and the reactivation of the latent infection. The infection can also be a novel strain, and therefore we should always consider what kind of exposure one person had to CMV. CMV generally occurs in people whose CD4 is less than 50 copies per ml. As we know, cytomegalovirus has a vast impact and it affects even the immunocompromised infections which are other than HIV. But in HIV, most commonly, it has various effects. The most common effect that we see is the ophthalmic inclusion of the CMV bodies, causing retinitis. It also causes infection in the neurological disorders, causing encephalitis, myelitis, polyradiculopathy, and peripheral neuropathy. Other than that, it can also cause hepatitis and portal vein thrombosis. We have also come across patients who are having pneumonitis with PJP and BP, and also some kind of myocarditis with increased risk for DVT. We have also seen patients with retinitis and also affected the gastrointestinal system, causing esophagitis, enteritis, or colitis. So CMV can affect multiple systems, and to diagnose CMV, we need to be very, very observable. We also have to do a battery of tests so that we can identify and treat the infection properly. CMV, as we know, is a chronic infection, and the isolation of the virus is one of the best way to take the virus. Now, the end organ diseases caused by CMV, which occur in HIV adverse suppressions, they occur when the CD4 count are less than 50 cells per millimeter cube. And also the people who are not adherent or receiving treatment for the antiretroviral therapy. Some patients can also be non-responding to antiretroviral therapy. Among those with treated ART who have achieved biological control, a new diagnosis of CMV and organ disease is very, very rare. CMV occurs in patients who are initiated. CMV is responsible for common viral infection, but we have to screen it at front. CMV retinitis is usually diagnosed clinically. The patient comes and says that there is a loss of vision, and the serological testing for CMV immunoglobulin is useful to support the diagnosis for the particular event. Parts of the gastrointestinal tract, like esophagus and colon, are also the common extraocular sites of severe infection in AIDS patients. CMV retinitis is seen as a fire in the forest-like vision, and there we can see that on the retinal examination, lot of spots which are peculiar of CMV. What is the treatment for CMV? CMV is treated with intravenous ganciclovir. Also, we can use intravenous postcarnate or pseudovir. But ganciclovir is easily available and hence it is used most of the times. The ganciclovir has a lot of side effects like hematological toxicity, while there can also be nephrotoxic events with pseudovir and postcarnate. There are ophthalmologists who are trained for treating CMV. They use intravitreal injections and with the antiviral agents also effective. But the inconvenient and the needs of repeat injection are the sad part of CMV retinitis. Now we also have intraocular implants. What are intraocular implants? Intraocular implants are the things that slowly release ganciclovir and effective both for acute therapy as well as long-term maintenance. But the occurrence of contralateral ocular and extraocular disease is a serious concern. Generally, the disease of CMV retinitis occurs only in the uniocular eye. There are also examples of new agents like anti-sense agents, which appear to be promising for the treatment of CMV. Now, the cytomegalovirus has also neurological diseases. Neurological diseases with CMV include dementia or ventricular encephalitis and polyradiculomyelopathies. Patients with dementia caused by CMV encephalitis typically have lethargy or confusion and in the presence or absence of fever. So how to diagnose this? For diagnosing, we need cerebrospinal fluid. The CSF typically demonstrates that there is lymphocytic pleocytosis. There is low to normal glucose levels and normal to elevated protein levels. Although normal CSF findings do not rule out the diagnosis of CMV encephalitis. Since the CD4 or immune power is less, it is difficult to diagnose CMV. Patients with ventricular encephalitis have a more acute course with focal neurological signs, often including cranial nerve pulses or nystagmus and rapid progression to death. So, how do we diagnose? The diagnosis of CMV and disease is typically based on the basis of clinical presentation and, when possible, there is evidence of virus in tissue. CMV retinitis usually is diagnosed based on recognition of characteristic retinal changes observed through a dilated pupil during an ophthalmoscopic examination performed by an experienced ophthalmologist. Diagnosis is that setting in that setting has a 95% positive predictive value. Yes, definitely it requires experience because CMV can be missed by a lot of other inexperienced people. We also have to discuss CMV colitis. CMV colitis is usually diagnosed based on the demonstration of mucosal ulcerations on the endoscopic examination, combined with histopathological demonstration of characteristic intranuclear and intracytoplasmic inclusions on the HE stains. CMV esophagitis is diagnosed by presence of ulcers of the distal esophagus together with biopsy evidence of intranuclear inclusion bodies. These intranuclear inclusion bodies in the cells are particular of CMV, which have an inflammatory reaction at the edge of the ulcer. CMV colitis also needs antiviral treatment, which helps them to treat them. For this, we can also use oral valganciclovir, which is effective in the short term as well as long term. So oral valganciclovir is a drug of choice. We can also give intravenous ganciclovir for 14 days, or we can also give induction of IV ganciclovir followed by oral valganciclovir for a maintenance. At first line therapies for treating severe retinitis, although postcarnate IV sildenafil are also effective treatment for CMV retinitis, substantial toxicities include nephrotoxicity and also uh, changes in the electrolyte should be seen. We also have to take care of starting the antiretroviral therapy with the patients with cytomegalovirus. Most of the times, we come across the worsening of the symptoms known as the immune reconstitution inflammatory syndrome, the CMV patients, as the CD4 of the patient is below 50 and patient is also infected with a multisystemic disorder. When we start with the antiretroviral therapy, there can be worsening, and then we can have treatment, we can have active retinitis, and also have CMV infection. So we have to monitor the response of therapy and also the adverse events, including iris. So indirect ophthalmoscopy of both eyes through dilated pupil should be performed at the time of diagnosing CMV retinitis, 2 weeks after initiating therapy and monthly thereafter, while the patient is still on the anti-cytomegalovirus treatment. Therapy has two effects. One, direct effect on treating the virus, and also secondly, decreasing the inflammation of the virus. CMV is a common disease which is seen in the regular practice, but in patients who are severely ill. Also, patients who are not taking medicines regularly can cause cytomegalovirus. CMV has a lot of other parts in which it can remain undiagnosed, as the patient with cytomegalovirus seldom have fever or symptoms suggesting any kind of inflammatory infections. Most of the times, when the patients come from physicians or general practitioners, they cannot diagnose it, and the patient can land in a lot of other issues. CMV is a common infection in India as well as abroad, and diagnosing of CMV can help to stop the infection from the one part of the system to the other system. If we try to delay the treatment, definitely things can turn fatal, and we have to find out the reasons why we have to work in as soon as possible for treatment of CMV. Now, cytomegalovirus is there all over our system. Therefore, we should prevent the spread of CMV infection. How can we prevent the spread of the CMV infection? We can prevent it by washing our hand with soap for 15 to 20 seconds and more often. Also, we should avoid contact with tears and saliva while kissing a child, because that can also lead to infections. We should avoid sharing of foods and glasses, careful disposal of diapers, handkerchiefs, and use paper napkins. Also, practicing safe sex and using a condom will definitely help to keep the CMV infection on a lower side. I would also like to add the people who are infected with the HIV virus and whose immunity power are low should avoid to go for public places or crowded places where they can attract infections. People also should avoid most of the public hospitals or places where there can be sources of CMV infection. CMV infection can also come from the cats, and therefore having a pet cat or dog can give a chance of getting the CMV infection, which can live dormant in the body and then get activated. So people who are having immunocompromised diseases should stay away from pets or animals that can lead to such kind of infections in the long run. So this is in short the part of CMV that I could present to you. CMV is a very broad topic. And CMV infection to be studied in 30 minutes is not possible, but I wanted to come about with some kind of guidelines in which we could diagnose CMV in HIV positive patients and then have a rough idea to treat CMV. Any person who is having kind of blindness and is HIV positive, there are chances who possibly can have cytomegalovirus. Today, I occurred to me one of a patient, a young boy of 22 years old, a welder by profession, was referred by ophthalmologist to me for having cataract in both eyes. Now, since he has come today, I asked to do the routine test and get the other test for infection. So, in this particular patient, a person who is just 22 years old, who has got infection from his parents, both the parents have died when he was a child, raised by his uncle, is male most likely can have CMV infection bilaterally also. For that, we need to study and find out what are the things that can help to see these things. Today, in the era of the digital world, most of the young childs or people are affected uh, are affected by the overuse of mobiles and screens, which can also lead to worsening of the infection in the body. Therefore, we should be in a people who are having HIV infection should be careful while using things that can affect their eyes and get their eyes of sight checked regularly. Thank you very much.
Thank you so much, sir. Thank you for sharing your inputs with our viewers upon this topic. We have received few questions from the participants. With all your due permission, I would like to put across those questions to you. Yeah, so the first question is, among children with HIV and CMV disease, is treatment with anti-CMV antiviral agents in addition to ART associated with higher rates of remission, decreased mortality, or both?
If we start treatment with antiretroviral therapy and anti-CMV drugs, definitely the infection rate is covered up, the infection falls down, and the person gets better. But the drugs have side effects, and also the antiretroviral therapy and anti-CMV therapy, there can be drug-drug interactions. These drugs can have lot of other side effects like nephrotoxicity or skin reactions or GI disturbances, which should be monitored. If it is monitored and treated well, definitely a lot of people with CMV infection are living well right now from last 15 years.
Thank you so much, sir. Thank you for answering this question. We'll move to the next question that we have received, and the next question is there an indication for CMV antibody testing in children with asymptomatic HIV to guide clinical management?
Yes, a newly diagnosed person or a person who is infected with HIV should do a yearly test and find out if he or she having CMV or not. CMV tests are done when the CD4 count is generally less than 50. We can take to less than 100 and 200. Anybody who has symptoms or ocular symptoms, anybody who has issues other than this, then definitely we can have tests done, and this test should be done every yearly, which is a protocol that can help to diagnose and find out. As we are having a lot of good antiretroviral therapy now, the amount of patients with CMV is decreasing, but still it is not nil. We do come across patients who have CMV. We need to be careful while diagnosing patients with CMV.
Thank you so much, sir, for answering this question. We will take up the next question from another viewers of ours. The next question is, should infants born to mothers with HIV undergo screening for congenital CMV infection?
Pardon?
Should infants born to mothers with HIV undergo screening for congenital CMV infection?
Yeah, it depends on the CD4 count. Generally, in routine deliveries of babies with mothers infected with HIV, we don't have a protocol of screening for CMV. But yes, if the CD4 is low, if the mother has not taken any treatment, and if she has symptoms of CMV or if she is a carrier of CMV, then definitely we should go for congenital diagnosis of CMV in the child. But generally, if the mother is having some kind of diseases like CMV or rubella, then it is a protocol to terminate the pregnancy. But if the mother is healthy and she is not having other issues, I think uh, there is no need for screening for HIV as per the protocol of the National AIDS Control Organization.
Thank you so much, sir, for answering this question. We will take up the next question that we have received, and the question is: any role of experimental agents include leflunomide, an immunosuppressive agent, and aldostronate, an anti-malaria drug?
Can you repeat the question, please? The which is
Yeah,
the
what is there any role of experimental agents include leflunomide, an immunosuppressive agent, and artesunate, an anti-malaria drug?
no, actually, I have not studied about this particular therapy. I am not aware about the artesunate and the drug that you're discussing. Sorry to answer. Sorry not to answer.
Okay, we will take up the next question. And the next question is: what is the rate of CMV infection in immunocompetent adults with critical illness?
So the rate of CMV in the immunocompetent adults is a different topic as such. I don't know the exact number, but the patients who are having kidney disorders or have kidney transplant, they undergo or any kind of transplant, liver transplant or other transplant, then they undergo CMV treatment prophylaxis or to not to get affected by CMV. The rate might be very low, but definitely they need a treatment protocol for helping themselves to keep away from CMV during this immunocompetent way of having the CMV infection.
Thank you so much sir, for answering this question. We will take up the next question. And the next question is rate of increase in the level of CMV load predictive of symptomatic disease?
Pardon, is the data?
Is rate of increase in the level of CMV load predictive of symptomatic disease?
Yeah, if the amount of CMV virus increases in the body, definitely there are chances of having CMV infections. So, as I said before also, the people whose CD4 is less than 50 cells per ml of blood are having a higher chance of getting CMV. CMV is can be of two types. One, we can get the infection from animals like cats, or we can have a latent infection in the body with which gets reactivated when the CD4 is very low. So when the immune system fails, CMV can flourish and then it can act on various other bodies. It can be in the neurological part of the body or in the often commonly seen, or also lead to digestive system, liver. So a lot of areas are there where CMV can affect, and we need to find out because most of the times the symptoms do not correlate. We found out in my practice patients were having CMV accidentally. So there are things when people have that particular infection, but they do not understand that they are having that symptoms of like having a diminution of vision or loss of vision, which few people or few patients cannot appreciate when they are ill, sick, or admitted in the hospital.
Thank you so much sir, for answering this question. We will take up the next question. And the question is: what is your opinion on viral load values among different CMV tests are comparable?
A viral load value, yes, definitely the viral load, if it is higher, it can lead to infection. When the viral load is high, that means the virus has spread in the body that can damage or infect the cells, leading to higher presence of the infection. And this happens generally when the immune system of the body is damaged, that is, the person is having AIDS stage or for a last stage or end stage of the disease, and in that we can get a lot of other infections in the body. So viral load is directly proportional to the infection.
Thank you so much, sir, for answering this question. We will take up the last question. And the question is how to define antiviral resistance, which is a serious complication of CMV disease.
Yeah, antiviral resistance is a common thing that can happen in the person and for with the CMV infection. Though it is very low, but there are issues in people who have CMV resistance. And to find out, we need to do a resistance test, and this resistance test can let us know what kind of infection we are treating and how much is the resistance for the virus. So this particular issue is rare, but which should be kept in mind, and we should work on the diseases. Generally, when the virus uh, is resistant and the patient is in the in the stages of the last stages of the HIV AIDS stage and the CD4 is less than 50, it becomes difficult for the patient to thrive. But if we could make it a resistance and treat it well, then definitely we can have good results. So having a resistance test to be done in a patients who are resistant for CMV is a great thing.
Thank you so much, sir. Thank you for answering all the questions with so much of efforts of yours upon the topic that you have shared today. I would also like to thank all the viewers for their ardent participation that they have shown throughout the session by staying tuned with us and putting up such interesting questions to us throughout. So thank you to both of you. So, sir, with all your last comment, we can conclude the session here for today.
Yeah, CMV, though it is a rare infection, a very common infection, and we should be always aware that when we should check the CD4 count and the virus load of the HIV virus so that we can find out what different diseases can happen. If there is a diminution of vision or changes in the GI tract, definitely we should report it to the doctor who can help us to treat them effectively. Be alert, be vigilant, and try to fight this infection